Hello, AP students. This is Mrs. Politsky, and I have your notes for Chapter 5, States of Consciousness, Part 3, Altered States of Consciousness. So let's begin. When we talk about an altered state of consciousness, this occurs when some aspect of normal consciousness is modified by mental, behavioral, or chemical means. And hypnosis is one of those. It's an induced state of awareness, usually characterized by heightened suggestibility, deep relaxation, and highly focused attention. The term hypnosis is derived by hypnos, which was the Greek god of sleep, and a hypnotist will typically make a suggestion during this process to promote some kind of concentration and relaxation. The subject will soon appear to be asleep, but they can still hear the suggestions and carry out the request. Now, the big thing to remember here is we all still possess a certain amount of free will. And so if there is a suggestion that typically a person would not agree to perform under, they probably would not be pushed into committing some kind of act or doing some kind of behavior that they would not normally do when they have a certain state of awareness. So the hypnotist is more like an experienced guide showing the way. Hypnotizability, this is the ability to achieve a hypnotic state. To achieve a hypnotic state, the subject must have a certain degree of susceptibility or hypnotizability, which is measured by the subject's responsiveness to some kind of standardized suggestion. People vary in their degree of susceptibility from complete unresponsiveness to any suggestion to total responsiveness. A highly hypnotizable person may respond to suggestions to move their arms, to walk about, even to hallucinate. They might experience hallucinations for important memories and become insensitive to certain types of pain stimuli. Altered states of hypnosis, surprising findings. An altered state, Ernest Hilgen, back in 1992, proposed that hypnosis is a disassociated state involving a hidden observer in the person's mind, operating in parallel with the normal consciousness. Some surprising findings: experimenters can induce temporary mental conditions such as anxiety, depression, and hallucinations while a person is hypnotized. Some uses: as far as psychological treatment, it's effective in desensitizing phobic patients who are afraid of heights and other critters like spiders. It is also used for relaxation, training programs designed to combat stress. It's also used for a means of eliminating unwanted behaviors such as smoking. A post-hypnotic suggestion is usually given to those people who are hypnotized, and it's this suggestion that will carry on after the hypnotized state, which could be like a suggestion that the hypnotist gives to the subjects to diminish or to forget about their cravings, like cravings for cigarettes or food or such. Pain management is probably the one that we see more often. Some people use hypnosis as a way to avoid having to use certain pain medications during medical and dental procedure. In other words, they are kind of like giving themselves an altered state so that they can rise above any kind of pain. When we talk about things like Lamaze, that's kind of a form of this. Anyway, what is meditation? Meditation is a state of consciousness often induced by focusing on a repetitive behavior and assuming certain body positions to minimize external stimulation. Meditation may be induced to enhance self-knowledge, well-being, and also spirituality. So when you talk about things like praying the rosary, there's a certain repetition that goes with those prayers and a certain body position, perhaps, that can lead to a state of meditation. Meditators, these are or mediators, these are commonly begin with by concentrating on a repetitive behavior such as breathing, assuming certain body positions, and minimizing, obviously, the external stimulation, usually going into an area that is free from a lot of distractions and quiet. Anyway, it is viewed as an altered form of consciousness because it can be used for therapeutic purposes. Physical changes to the meditator, there's changes in brain waves. There's also some frontal lobe changes where frontal lobe produces changes that are associated with positive emotions. There's beneficial changes in blood pressure and stress hormones. Meditation produces relaxation and reduces anxiety, especially in people who function in a stress-filled environment. What are psychoactive drugs? Psychoactive drugs, for the most part, are chemicals that affect mental processes and behaviors by their effect on the brain. And humans have used drugs to alter everyday perceptions of reality for years. Especially under stress, people throughout the world take certain drugs for pleasure and for relaxation just to avoid the unpleasantness of their lives. Hallucinogens. These are drugs that create hallucinations or alter perceptions of the external environment or inner awareness. Examples of this would be mescaline, which is made from cactus, or psilocybins, which are sometimes known as mushrooms, LSD, acid, and finally PCP. Anyway, LSD and PCP are synthetic drugs made in chemical labs, and PCP's intensity and duration are really unpredictable, especially when they're mixed with other drugs. And there was a time when people would buy marijuana and PCP would be laced in that, and it caused some really scary hallucinations to erratic behavior. Other things, cannabis. This is derived from the hemp plant. It also acts as a hallucinogen. Its active ingredient is THC. This is found both in the plant's dried leaves and flowers, the flowers are known as marijuana, and the solidified resin, which is known as hashish. Anyway, small doses can create mild, pleasurable highs. Large doses can cause long term hallucinogenic reactions that can last for hours. Pleasant effects, this might lead to altered perception, sedation, pain relief, mild relief from kind of the world around you, and then finally, mild pain relief, that is, distortion of space and time. Unpleasant effects, this could be a mix of fear, anxiety, confusion, failure of memory, impairment of motor coordination. Habitual users can become psychologically addicted to its pleasurable effects and crave the drug so that it interferes with their daily life. THC causes the release of dopamine, which affects the brain's reward system. So if a person is using this for a period of time, it is potentially possible that you could develop some form of addiction because of this release of dopamine. Opiates, these are highly addictive drugs derived from opium. They can produce a profound sense of well-being and have a strong pain-relieving property. These drugs suppress the physical stimulations and responses to stimulation, including painful stimulation. Along the way, morphine and codeine have particularly had good anesthetic properties. They basically are for pain relief. When you talk about codeine, for years that was mixed in with certain cough medicines. Anyway, the properties that result from their similarity to the body's own pain relieving chemicals, such as endorphins. Heroin is derived from morphine. It was developed back in the 19th century by the German company Bayer. Bayer is known for making aspirin as well, but it has abandoned this because it's even more addictive than morphine. This drug produces a rush of pleasurable sensations, and these feelings can lead to things like euphoria, which is like a high. It supplants all worries and awareness of bodily needs, such as hunger and such. There is no change in the cognitive ability of a person who is experiencing a heroin high. But serious addiction is likely once a person begins to inject heroin. Anyway, addicts must take the drug frequently to kind of keep that level of high, and it makes it a very expensive habit to maintain. And there's also a concern that once a person kind of goes off the drug for a little while and then they come back to use it, if they're using a dosage that was as high or as large as what they previously had used, it can also prove to be fatal. Anyway, methadone is a synthetic opiate that can be taken orally, and therefore it doesn't require injection. And methadone has been used to treat people who have been addicts. It has the same euphoric, pain relieving, and addictive effects as heroin, but when taken orally, methadone doesn't produce the same kind of rush. And because the drug level in the brain increases slowly. So this makes methadone a useful substitute for heroin and drug treatment programs, kind of to wean people off of it. But what we're finding today is that there are a lot of people who are addicted to methadone. Anyway, patients who take opiates for pain control under medical supervision rarely become addicted. Anyway, the presence of pain causing opiates affect parts of the brain and other than the reward centers involved in pleasure. Depressants, these are drugs that slow down the mental and physical activity, inhibiting the transmission of nerve impulses in the central nervous system. It slows down mental and physical activity of the body. It can also relieve symptoms of pain and anxiety. Overuse can lead to things like addiction and abuse. And the dangerous side is that this drug can impair your reflexes and judgment, and hence it can be addicted. So barbiturates, these were once referred to as sleeping pills because they induce sleep. They do not reduce the amount of REM sleep, commonly prescribed for sedation, so for people who need to sleep. Benzodiazepines are commonly prescribed to treat anxiety, and they're supposedly safer than barbiturates. These are referred to as minor tranquilizers, such as Valium or Xanax. Anyway, this can be abused as well. When a person overdoses on either one of these, they have poor muscular coordination, slurred speech, weakness, irritability, and they may withdraw because of increased anxiety, muscle twitching, and sensitivity to light and sound. Alcohol acts as a depressant on the brain. It depresses the activity in brain circuits that normally control self-monitoring of thoughts and behaviors. And hence, some people who take alcohol may become more talkative or more quiet. You can become friendlier, overly friendly, or extremely abusive. So it just depends. Anyway, very small doses can induce relaxation, even slightly more improved adult reaction time, but not necessarily when it comes to driving. Anywho, larger amounts can impair body coordination and mental processing. The body breaks down alcohol at a rate of only 1 ounce per hour, so greater amounts can stay in the body and depress it for a long period of time. Anyway, when the level of alcohol in the blood reaches 0.1, an individual experiences deficits in thinking, memory, judgment, and emotional instability, as well as coordination problems. Roughly 5 to 10% of Americans who drink alcohol use enough to harm their health, career, family, and social relationships. Physical dependency. This is a tolerance or addiction to all that develops with prolonged heavy drinking, binge drinking being that. The abuse of alcohol is a problem for roughly 15 million Americans, and fetal alcohol syndrome can lead to mental retardation of children, especially when we talk about mothers who have conceived but don't realize that they are pregnant. Roughly 40% of Americans see alcohol abuse in their family, and roughly from ages 15 to 25, alcohol-related automobile deaths are the leading cause of death. Stimulants. These are drugs that arouse the central nervous system. They speed up mental functioning and physical responses. Addiction can increase concentration or stimulants can increase concentration and reduce the hyperactivity behavior seen in people with attention deficit hyperactivity disorder, or ADHD. Stimulants in narcoleptic patients can help reduce sleep attacks. The effects of a stimulant, they can be somewhat pleasurable, maybe increase self-confidence, greater energy, alertness, but also euphoria. When we talk about cocaine, this packs a very powerful, rewarding punch of any illegal drug. Crack, especially, is addictive. As a form of cocaine, it produces swift, pleasurable highs that wear off fairly quickly. Amphetamines, which used to be known as speed, this and other related drugs that affect comparable to cocaine. Methamphetamines, which is a little more popular today, goes back to the 1990s. MDA or MDMA, also known as ecstasy, can produce a feeling of euphoria and energizes the user for hours, leading to things like dehydration, convulsions, and impaired memory. People addicted to amphetamines or cocaine may experience hallucinations and have paranoid delusion symptoms. When we talk about secondhand effects, children who are exposed to cocaine in vitro, studies show that these children are at an increased risk of developing cognitive problems, emotional difficulties, and behavioral control disorders. Caffeine, 2 cups of coffee or tea can deliver enough caffeine to have a measurable effect on the heart, blood circulation in the brain. Nicotine is an inhaled or chewed form of cocaine or tobacco or nicotine. Sorry about that. It has similar effects to caffeine within just a few seconds. Both of these can tease the brain's reward pathways into responding to nicotine and caffeine as if it were beneficial to us. Nicotine is more dangerous for a couple of reasons, because it is highly addictive and it's been associated with a variety of health problems, including cancer, emphysema, and heart disease. The American Medical Association has formally recommended that the U.S. Food and Drug Administration regard nicotine as a regulated drug. And even though nicotine is legal and actively promoted, it is a $2.7 billion industry. Dependency and addiction, many psychoactive drugs have a weaker consciousness altering effect with continual use. As a result, the user will need a larger and larger dose to achieve the same effect. So you develop this thing called a tolerance. This is the reduced effectiveness to a repeated use of drug. Physical dependency, this is the process in which the body adjusts and comes to need substances and part of production of the neurotransmitters. Physical dependency goes hand in hand with tolerance. Addiction is the condition in which a person continues to use a drug despite its adverse effects, often despite repeated attempts to discontinue using the drug. It can be based on both the physical and the psychological dependence. Withdrawal is a pattern of uncomfortable and painful physical symptoms that's usually experienced when a person goes off of a drug. So you may have physical trembling, perspiring, nausea, increased sensitivity to pain, and maybe even in extreme cases, death. The psychological dependence, this is the desire to obtain and use a drug, even though there's no physical dependence. So like some people like to go see the people who are the drug dealers because they kind of enjoy hanging around them. Thank you very much.